Welcome! Congratulations on your upcoming retirement. In this video, we'll review how to complete your DOE health benefits application so you and your dependents will have health coverage in retirement. Members are vested with TRS and BURS after 5 years of service. However, there are different rules with the DOE and health benefits. Depending on when you were appointed, you may require 5, 10, or even 15 years of TRS-credited service to retain your health benefits in retirement.
If you or anyone on your health plan will be 65 at the time of retirement, they must have Medicare A and B in place at that time. Contact Medicare 3 months ahead of retirement to make sure this is set. This is a form we file with the DOE to ensure our health benefits continue in retirement. You can find the form at the links on the screen. You will need to print it and physically sign it.
In Part A, you will check your reason for applying. For most of you, it's the first box, new retiree enrollment. But if this is a disability retirement, you would check disability retirement or accident disability retirement. If you are getting your health coverage elsewhere and don't want to claim your benefits, you would check the waive benefits box. New retirees can skip Section B and C. The only new retirees who would fill in anything in Section C are people who will need to change plans because they are moving to a new area that the current plan does not cover. In Section D, fill in your personal information, including your full Social Security number. You don't have a pension number yet, so leave that blank. Select your current marital status and the date of event. This means the date you were married, divorced, or your spouse passed. Make sure you give your personal email. The DOE email will be shut off when you retire. You only need to fill in the name of your current healthcare plan if you are changing plans. If you are Medicare eligible, you will fill in your MBI number and attach a copy of the card. Under agency you are retiring from, you can fill in NYC DOE, and for union, you will fill in UFT. Most of our current members are TRS, though there are a few of you who may have retired with BURS.
Section E only needs to be completed if you're covering a spouse or domestic partner. Otherwise, you can skip this section. If they are also employed by a city agency, you must check the Yes box on the top right and include the name of the agency. Also, if they're Medicare eligible, as in 65 and over, you must indicate in the last item of Section E and attach a copy of their Medicare card. If you've been covering any children, you'll fill out Section F. If not, skip this.
In Section G, you will put an X next to the plan you are enrolled in. You can only change plans at retirement if you are moving to an area outside of your plan's coverage or on Medicare. Don't skip over the optional rider question. This is where you will select whether you are taking the prescription drug coverage or not. If you don't check yes here, they will assume no and you will not have prescription drug coverage.
Part H is the reason this form needs to be printed. You must sign this by hand and date it. Skip Section I. That is not for you to fill out. Congratulations, you have now completed the health benefits application.
Now that you've completed the health benefits application, you can scan it and upload it to the HR Connect portal. Log into your HR Connect portal account and go to the Upload Documents tab. Click on the Select Category tab and choose the first option, Benefits Transaction. In the subject section, type Retiree Health Plan Enrollment Process. In the Notes field, list the files you're attaching and then attach those files using the Choose File button on the bottom of the page. The documents you will need to upload are your health benefits application, your retirement receipt from TRS or BURS, and copies of Medicare cards for you or your dependents if any of you are Medicare eligible. Then click Submit. If you are not in active service but have separated from service prior to retirement, then you have additional items you need to send. If you've separated from service, you must also send along a marriage certificate or proof of domestic partnership for a partner you're covering, as well as proof of cohabitation and birth certificates. For more information about health benefits, you can always call the Welfare Fund. You can reach them at 212-539-0500.
This video should not be solely relied upon, as it is based on currently available information that is subject to change. In all cases, the specific provisions of the governing laws, contractual agreements, rules, and regulations prevail.